Welcome back. As noted before we went to break, the Trump administration is canceling nearly $500 million of vaccine development projects using mRNA technology. That's messenger RNA technology. This is how Health and Human Services Secretary Robert F. Kennedy Jr. explained the decision.
Most of these shots are for flu or COVID, but as the pandemic showed us, mRNA vaccines don't perform well against viruses that infect the upper respiratory tract. mRNA technology poses more risks than benefits for these respiratory viruses.
Kennedy also said his department will be replacing mRNA programs with, quote, safer, broader vaccine strategies. Dr. William Schaffner joins me now. He's a professor of infectious diseases at Vanderbilt University. Doctor, it's great to have you with us. Thank you for your time. Can you evaluate what the HHS secretary said, that mRNA vaccines don't perform well against respiratory viruses and that they pose more risks than offer benefits?
Well, Major, it's really very clear that not only our own Food and Drug Administration, but similar organizations in all the major countries of the world, the Canadians, the British, the French, the German, all the Scandinavian countries, the Australians and the New Zealanders, all have decided, looking at all the data, that the mRNA COVID vaccines have been very, very successful. They have prevented millions of deaths, even more millions of hospitalizations, and are, with rare exceptions, very, very safe. So I think it's disappointing that in the federal and private combined research activities that we have, that this stimulus money to look for more targets for mRNA vaccines, including cancer prevention, is now going to be curtailed, unfortunately.
Yeah, Doctor, dig a little bit more deeper into that over-the-horizon perspective, meaning these are developmental ideas, dollars for future things, not to reimagine the mRNA vaccine we use for COVID, but to try to find if that technology is applicable elsewhere. What could be lost?
Yeah, that's correct. And this is a technology that we've studied now for over 20 years. So it's not, quote, quote, new by no means, but it can be applied now to many other areas. And you know, the most noble goal of medicine is the prevention of disease, the elimination of disease. And there are opportunities here for the mRNA technology to work in perhaps diabetes and certainly cancer, as I've said, as well as other respiratory viruses. That research program nationally will now slow down, unfortunately. And you know, if, or perhaps I should say, when we have a new pandemic, we'll want to have the best vaccine technologies available. We ought to be looking at all of them and not restricting any.
Doctor, the HHS Secretary Robert F. Kennedy Jr. said there will be an emphasis now on whole virus vaccines and novel platforms for this kind of research. Scientifically, what does that mean and what does that portend?
Well, we have many vaccines currently available and licensed, and they've been developed using a variety of different technologies that have been updated over time, made more modern. And there are other technologies available that we should absolutely pursue, but we shouldn't foreclose the use of one very promising technology that the scientific community is quite excited about.
Professor of Infectious Diseases at Vanderbilt University, Dr. William Schaffner. I appreciate your time, sir. Thank you very much.
Thanks, Major.